Tonight, North Carolina health officials say they're closely monitoring a rare hantavirus outbreak linked to a cruise ship after one North Carolinian was among those exposed. State leaders say the risk to the public remains very low, but federal and state agencies are still tracking those who may have been exposed. WCNC Charlotte's Anna King is in studio joining us with more. Anna?
Yes, state health officials say they're working with the CDC after a group of Americans on the cruise ship were exposed to the Andes virus, which is a type of hantavirus. Investigators say 16 Americans are currently being monitored in Nebraska, including one person from North Carolina. 2 others are being monitored in Atlanta.
There are patients that have become infected with Andes virus, which is a particular type of hantavirus.
Tonight, North Carolina health officials say some of the exposed Americans were taken to the University of Nebraska Medical Center for monitoring, including one North Carolina resident.
If they stay there, they will continue to be monitored. And if they come home, they would be monitored by their respective local health department. They have not been tested, as far as I know.
Health officials say some passengers left the ship before federal officials could coordinate a response, returning to states across the country. And when asked if quarantining would be required, officials shared.
The CDC is not using the word quarantine, but they are keeping them for a risk assessment and clinical monitoring at Nebraska, and the people are free to stay there if they wish to.
North Carolina health officials stress this virus is very different from COVID-19. It's most commonly linked to contact with infected rodent droppings or saliva. Health experts say the virus has a 40% mortality rate and explains these common symptoms.
People generally get significant symptoms related to their lungs and breathing and pneumonias, and they're septic and they're quite ill.
Health officials say the 4 to 8 week incubation period means it could take several weeks to learn more about how this virus is behaving. Yeah, North Carolina health officials continue to stress there is currently no threat to the community. Back to you.
All right, thank you, Anna.